Deciding how you want to give birth is a deeply personal choice. Some patients consider an elective C-section for a variety of reasons. In this video, we'll explore the benefits and risks of a planned C-section and how to determine if it's the right option for you.
What are the most common reasons a patient might consider an elective C-section?
Sometimes a cesarean birth is needed for the health of the baby and mom. However, more women are now having cesarean births for non-medical reasons. It's important to understand that a cesarean delivery comes with more risk and fewer benefits. The most common reason a patient might consider an elective cesarean section is having a history of a prior C-section. For those women who have had no history of a C-section but consider having an elective C-section, some reasons may include a concern for a larger than average baby, a previous extensive vaginal laceration, fear of labor, and fear of pain that is associated with labor.
What are the key differences between a vaginal birth and a C-section?
The key difference between a vaginal birth and a C-section is how the baby exits the body. Vaginal deliveries are the result of a baby being delivered through the vagina. This contrasts with the C-section, which is a major abdominal surgery where the baby is delivered through the abdomen. All the layers of the abdomen and uterus are cut into and repaired after delivery of the infant.
After a vaginal delivery, you will be in the hospital for 1 to 2 days postpartum if your course was uncomplicated. After a C-section, you will be in the hospital for 2 to 3 days postpartum, depending on your course. Although these are general recommendations, your care will be tailored to your medical needs.
What are the potential risks associated with an elective C-section?
The risks of an elective C-section include risks for both the birthing person and the baby. Risks for the mother include increased blood loss, increased risk of infection, longer hospital stay, and longer recovery time. There's also increased risk of blood clots, which can cause pulmonary embolism and DVTs. There is also risk of injury to organs and structures near the uterus, and complications in future pregnancies, which may involve the placenta and adhesions in the abdomen and pelvis.
What factors should a patient consider before deciding on an elective C-section?
When considering your delivery plans, and if you're thinking of having an elective C-section, it is important to consider your needs. Without any contributing medical history, the earliest you will be scheduled would be at 39 weeks pregnant. C-sections require pain medication. This is done through either a spinal or epidural medication. Both of these methods are performed by giving you medication into your back, which will numb you from the belly button to your toes. After surgery, you will receive pain medication for relief. In addition to the current pregnancy, you should consider your future pregnancies and how many children you may want in the future. Although having a birth after C-section or VBAC is possible, there are risks, including abnormal placenta formation and uterine rupture, or separation of the previous C-section scar. Notably, after having 2 C-sections, most providers will no longer give you the option of laboring, and a repeat C-section will be required.
How does Northwell support patients who choose an elective C-section?
At Northwell, we believe strongly in shared decision-making. Your doctor or midwife will want to know what thoughts and concerns you may have surrounding a vaginal birth, since in most cases, a vaginal birth is the safer option. After understanding your concerns, our focus will be on understanding the risk, alternatives, and benefits of a C-section, and answering whatever questions you may have. Keeping in line with the American College of Obstetrics and Gynecology, we support a woman who, after being informed, continues to desire a primary C-section. Elective C-sections can be a good option for some patients, but it's important to weigh the risk and benefits carefully. If you're considering a planned C-section, talk with your healthcare provider to make an informed choice that aligns with your medical needs and personal preferences.